Hi, I am Dr. Ruth Wolever. I'm from Duke Integrative Medicine, and I'm a health psychologist by training. I do research, clinical research, and practice psychotherapy with a lot of mind-body influence. Several of the things that I'm really passionate about and have been working significantly on, I'm really interested in how people change their behavior and how you support that change in behavior over time. So I do that from a psychotherapeutic perspective and also from a health coaching perspective. I've been for the last 10 years really involved in trying to define and disseminate this idea of health coaching based on an enormous body of evidence that we have from psychological research. So from developmental theorists, from outcomes research in psychology and in psychotherapy, and from behavioral medicine research. One of the biggest issues really is the definition of what a health coach is, because across the country and probably the world, people are doing different kinds of things and calling them health coaching. A lot of them are educational in nature, and when I say health coaching, I'm actually referring to something that may include education, but education provided only in a very specific way. A health coach is really more about how to help an individual figure out their best way of learning, their best way of exploring and trying on new behaviors. So what typically happens in a lot of conventional medicine, and certainly in a lot of health promotion even, is that individuals are thought to need information, and once provided information can perhaps make changes. And we know that that's useful, but not nearly sufficient. When individuals really connect to what they most care about, when they're really able to link some set of behaviors that are beneficial for their health and their well-being, when they're able to link that to what they really value and what they really care about, that behavior change is really powerful for them and very much, I believe, sustainable. So we see this clinically. We're trying to get data around this empirically. To get some rigor around the definition of health coaching, a group of individuals have come together. We started in 2010. We now have 80 stake members, organizations and individuals from academic medicine, from industry, from training organizations, from the government, trying to get some consensus and develop, through a rigorous process, a definition that could standardize the credentialing process for health coaching and also standardize the curriculum process so that we're able to really kind of move the research forward, for one thing, to compare apples to apples instead of apples to oranges. The mindfulness meditation or other self-awareness practices really helps individuals, I think, sort internally what is important to them and helps them learn a lot about, how we behave, because our behavior is driven by emotion and sensation and thought, and it's complex. So in order to really learn internally, I think the ideal setup is having some sort of self-awareness practice, and then also, in order to be encouraged and supported and able to process the use of new skills, having this sort of external support of a health coach.